This project is about obsessive-compulsive disorder.
This is some basic information about obsessive-compulsive disorder. Obsessive-compulsive disorder is defined as an anxiety disorder that is characterized by uncontrollable thoughts, as well as repetitive or ritualized behavior that a person feels compelled to perform. These tasks are often time-consuming and can create difficulty functioning in everyday life. More specifically, obsessions are involuntary and seemingly uncontrollable thoughts, visualizations, and/or impulses that reoccur over and over again. These obsessive thoughts and feelings can be distracting and disturbing from day-to-day life. In addition, compulsions are behaviors or rituals that one feels compelled to do over and over again. They can often cause anxiety because they are demanding and time-consuming.
Now you'll be watching a video with some facts about OCD.
Obsessive-compulsive disorder affects 1 in every 40 people. That represents about 2.5% of the entire population. This is a surprisingly large number of people, but it should be noted that of those 2.5% of people, only a few will have OCD to a level that affects the quality of their lives. The vast majority of people are aged between 19 and 25 at the time they're diagnosed with OCD, although some people and their doctors fail to recognize the symptoms as OCD, and so they're often misdiagnosed until their 30s or 40s. Did you know that the average person will live with their OCD for 17 years before they seek help of any kind? That's a staggering statistic, especially when you consider OCD's degenerative qualities and how the condition usually worsens over time. The earlier action is taken, the easier recovery will be. There are many doctors and psychologists who are still not well informed when it comes to OCD, its symptoms, signs, and treatments. This can lead to years of misdiagnosis and unnecessary suffering. To prevent this happening, more and more people with OCD are taking the time to learn all they can about their own condition in order to reduce the risk of misdiagnosis and to find a treatment suited to their own specific needs. Despite many theories to the contrary, OCD actually affects men and women equally. In the past, this statistic was often skewed due to the tendency for less men to seek help or advice for a problem like OCD. But the stigma that once prevented men from seeking help has long since faded, and OCD is now considered by the population at large as a legitimate and treatable form of anxiety disorder. Learning some simple facts about OCD is a great way to start finding your own path to recovery. People with OCD who learn all they can about their condition typically experience a much quicker recovery and less chance of relapse.
Now for a brief history. OCD has been well known since the 1400s, but at first it was thought to be more of a superstitious thing than an actual illness. By the 1600s, people had started to go to clergymen for some help with their symptoms, so it was written about by the clergymen. One of them was John Moore, who was the first person to realize that when people tried to suppress their compulsions, they would eventually get worse. And it was also written that OCD was caused by underlying anxiety. Marjorie Kemp, although she was around in the 1400s, was the first person to write about actually having OCD. Once the 1700s arrived, clergymen started referring people to physicians instead of treating them themselves. And this is when physicians started to become familiar with the symptoms, and then by the 1800s, people were beginning to be committed to asylums. But by the late 1800s, they were characterized as mental illnesses, and specific types of OCD were given specific names. For example, erythmomania was obsessions of counting, and misophobia was another obsession. There's just different names for them. By the time Freud came around, he over-sexualized things just like he has about other things. So there was a girl who had to fluff her pillows every night before she went to bed in just the right way, and she always had to fix her clocks the right way, and Freud took it that the clock symbolized her ovaries and the pillow symbolized pregnancy, so he took it as she was worried about pregnancy and her biological clock. As the 20th century rolled around, behavior psychology became a more popular form of treatment rather than just throwing people into insane asylums. the behavior psychology gave way to medicine, such as anafranil, Prozac, Luvox, Zoloft, and Paxil.
Now for the signs and symptoms of OCD. One aspect of the signs and symptoms is obsessive thoughts. These include such things as fear of being contaminated by things like germs or dirt, or the fear of contaminating others. It also includes the fear of causing great harm to yourself or other people around you. It can include intrusive thoughts or visualizations or images, often associated with violence or sexual activities. Excessive focus on religion and moral beliefs or values. Fear of losing or not having things that one may need, which can often lead to hoarding. Order and symmetry, which is the idea that everything must be perfect or looked just right, leading to a lot of organization. It can also have to do with superstitions and superstitious people who pay excessive attention to something that may be considered lucky or unlucky. It also includes compulsive behaviors, such as excessive double-checking of things that could cause harm, like making sure that you've turned off the curling iron or something like that. Repeatedly checking in on loved ones to make sure they are safe. Counting, tapping, or repeating certain words or doing other senseless things to reduce anxiety. Spending an exorbitant amount of time cleaning and washing oneself or things. Ordering and arranging things so they are perfect, which has to do with organizing, as mentioned before. Praying excessively or engaging in rituals triggered by religious fear. Sometimes people, if they fear God or something like that, then they will be OCD about it and do it excessively. And finally, accumulating stuff that is not necessary in one's life, such as hoarding. In addition to this, OCD usually only is seen in adolescents or adults. It is sometimes seen in younger children, but most of the time it's actually symptoms of another disorder, such as ADD or autism, because these symptoms often overlap each other in small children.
There are different categories of OCD. Some of these are washers, who are people who are afraid of germs or dirtiness. So these are the people who are known to constantly wash their hands. They might wash their hands 3 times with soap. There are checkers, so people who repeatedly double check things. If the curling iron is off, if the garage door is closed, if their door is properly locked. Doubters and sinners are people who are afraid if everything is not perfect or done perfectly, then a terrible thing will happen. So these are the people who have a lot of anxiety if they don't pray or something like that. Counters and arrangers are people who are obsessed with order and symmetry and often have superstitions about certain numbers, colors, or arrangements. So that person who always has to have the pencil perfectly aligned on their desk, if they have OCD, that is one of their tendencies. Also, there are hoarders who fear that something bad will happen if they throw something away, and they also have a compulsion to hoard things even if they don't use it.